Welcome, dear viewers. I am Dr. Kannappa Setty, Assistant Professor and Bachelor of Social Work Program Online Coordinator in the School of Social Work, Indira Gandhi National Open University, New Delhi. Today, we will be discussing on substance abuse and counseling. This program is a part of Bachelor of Social Work, and the course code is BSWE 006. So let's understand what is substance abuse. I would like to give a simple definition or simple meaning, or you can also say simple clarification on the term what I have used, substance abuse. Any drug or any substance which can alter the mind or mood of individual, that can be called as substance or drug. So now very important aspect, the types of substance. Mainly there are two types, that is legal substances, second one illegal substances, or legal drugs, illegal drugs. You might have heard or you might have seen in your locality or in your family or in your community where people are using both legal drugs and illegal drugs. This session not only helpful for Bachelor of Social Work students, Master of Social Work students, or even social work students from different streams. This will also helpful for any student or any worker who is working in the health field. Otherwise, even any person who wants to understand the ill effects of substance abuse. So it will give a comprehensive understanding as well as what are the interventions can be done for this particular issue that is called substance abuse. So I just wanted to give you some information on what are the legal drugs. As I said in the beginning, many of you might have seen or observed or even experienced some of the legal drugs. For example, alcohol is a very commonly used substance in our country, of course across the globe. And next common legal drug or substance is nicotine. So that is nothing but tobacco product. So this nicotine is available both chewing and smoking form. So what is a chewing? Nicotine, we very often we see people are using like a pan. Nicotine products they use as a pan. They chew it. So what is smoking? BD, cigarette. So all of them. So they are all part of nicotine products or tobacco products. So these are all the very commonly used substances in our country. And now what are the illegal substances? That also you might have come across or you might have seen in the TV or even read in the newspaper, or with your friends you might have heard, or in locality you might have seen where people are using illegal drugs. So very commonly used illegal drug in our country is marijuana. That is nothing but cannabis. In a simple form or local form, that's a bong. Though it is a illegal drug, but we do see people are using this drug in our society. So nothing but it is a very illegal substance. And what are the other substances? Illegal substances: heroin, brown sugar, cocaine. The list goes on. There are a number of illegal substances in our country. Now another category is prescription substances. The first one is legal, the second one is illegal, third one is prescription, substances or drugs. So again, this is a legally available, but if you take beyond that, it will cause a lot of side effects or health issues. For an example, cough syrups, sleeping related tablets, or any disorder related medicines like anti-epileptic, like that. So there are certain medicines, cough syrups, where people use for various reasons. So they are called prescribed substances. So the very important aspect, dear viewers, you should understand now, why do people start substances, whether legal, illegal, or prescribed substances or drugs? Why do people start? So you might have wondered how people will start, or why do they start, isn't it? So this is a very important question to understand, why people start this substance. Dear viewers, you may have a number of answers in your mind, or you might have read or told by someone else who is using this particular substance. But however, there are some scientific reasons why people start these substances. So I could able to give some of the very important the reasons are peer pressure. This is a very common reason why people do start substances. Whether you take it Delhi or any state in India or even globe, people do start this drug or this substance mainly because of curiosity. So this is a very common cause. People want to see, if someone is using, they want to see, what cause for this person to use this drug, or what will happen if I start this, or if I consume this, or if I start using this. So these kind of questions may arise in their mind, and some of them may start curiosity per se. So that is the main reason. Another reason, second important reason, is curiosity. So first is peer pressure, second is curiosity. Just peer pressure means their friends or their colleagues, they may pressure. Second one, curiosity sake. The third one is imitation or modeling. So imitation modeling means there will be a number of people in the society or in the community or in their family. So they try to imitate them. If elder in the family, father in the family, or brother in the family, or any person in the family, they are using cigarette or bidi or tobacco or alcohol or bhang, so they also try to observe very carefully and see what their family members are using it, or if their friends are using it. So they try to imitate them, follow them. So this is another reason. And another very important the reason why people do use substance, that is very importantly, myths and misconceptions. So people do think that this substance may give them good health, good memory. In case if the students are going for the examination, they think that, okay, if I take a cigarette, it will help me to remember many things. I can write in the exam. So this is a kind of myth or misunderstanding or misconceptions. Similarly, many software engineers, they do come out of their office and take, in one hand they take cigarette, in another hand they take tea or coffee, and they think that if I smoke, most of my stress may come down. So this is also another kind of myth. Similarly, many people in the community, they think that I have a lot of problems, lot of pain, lot of sorrow, lot of issues in the life. It could be finance related issues, it could be occupation related issues, lot of pressure, stress. So I'll take alcohol so that it will be gone. So they think that by drinking alcohol, by consuming alcohol, my problems are solved. I am completely free, stress free. So this is another major myth. There are other people, they think that if I take this drug, for an example, when I was in the previous medical college as a faculty, I do get some clients coming for alcohol de-addiction, nicotine de-addiction, or cannabis related treatment. They do say, if I take cannabis, my sexual function will improve. So this is another myth. So like that, many people come up with their own rationalities, their own reasons, but all of them are not true. So we need to understand that there are n number of myths, misconceptions, and misunderstanding related to various substances. So when you are trying to deal with them, explain to them, counsel them, or provide treatment to the individuals who are part of substance addiction, any part of substance addiction, or even for their families, as a counselor, you need to educate them, explain them scientifically. These are the myths and misconceptions related to any substance. So we have to, as a social worker, as a counselor, even as a welfare officer, you will be working in various settings. You will be working as counselor in hospital settings, consultation settings, industrial setting, NGO setting. You may find these kind of families, individuals are suffering from various substance abusers. So when you are doing counseling with them, systematically, slowly, you will have to explain the scientific demerits of these drugs. Otherwise, they will not understand. And when you are explaining to them, you will have to correlate between their symptoms and these demerits of these substances. So this is very important. Otherwise, the counseling method, especially working with people using any drug, mainly alcohol, nicotine, cannabis, heroin, brown sugar, cocaine, they do not follow your advice very easily. So you need to know that they are in the level of addiction. They may not be receiving your suggestion very properly, and they are demotivated and they don't want any kind of treatment. So mainly there is a very classical verbatim. When we work in an alcohol de-addiction setting, people say, people in the sense the patient or individuals addicted with any kind of substance, they say, I have no problem. They say like this to the doctor or counselor, hello doctor, I have no problem. I am perfectly all right. This person, means whoever the family members brought them to hospital, they have a problem, you treat them, you leave me alone, I'll go. So this is a very common verbatim saying by these people, individuals abusing with alcohol, cannabis, bong, or nicotine, cocaine, all drugs. They say, I'm perfectly all right. In fact, I am not getting any problems because of these drugs. I want these drugs to take care of my life. So I don't want any treatment. They very assertively, they refuse your counseling, treatment and all. So please do understand, your patience is very important. So there are patients, there are clients struggling with various drugs. So when you want to deal with them, you will have to have a patience, and systematically you will have to go by various methods. I am going to explain what are the different counseling methods you are going to use with them. And of course, you are also working with the family members, wife, children, or their parents. You need to work with them as well when you are providing substance related interventions. So next, very important, as I mentioned earlier, that there are a number of reasons. So I don't want, this is a picture I would like to show how peer pressure may cause for this substance addiction. The next picture I'm going to show curiosity. So this is also again how children or people in the society, how they will learn. So I'm going to show you another picture. This is a imitation. So modeling. So that, see why I am showing these pictures, our learners can understand easily both audio, video, and this pictorial presentation can help them to understand the topic very easily. That is the reason. So this myths and myths related to substance I have already mentioned. Now, very importantly, commonly abused substances in our country. As I mentioned earlier, alcohol is very commonly used, nicotine, tobacco products very commonly used, and cannabis, nothing but bong, very commonly used, and opioids, caffeine, solvents are again very oftenly used these substances in our country. So, dear viewers, and very important aspect now, when does it become a problem? So, for example, every person using substance will become a problem? No. See, there are some criteria to say that this person is having a problem or not. So, for example, people, those who want to try, it is a kind of, they are in the beginning stage of substance use. So, use, abuse, dependency. So, like that, there is a criteria. So, when is the problem? That again we will have to say with some scientific criteria. For example, the people, those who are using any kind of substance, whether legal substance, illegal substance, or prescribed drugs, there are certain criteria where we can assess, we can tell them, or we can see them. Look, these are all the issues you are having. These are all the criteria you are having. That means you are in the problem now. So that means your verge of developing various complications that will collapse your family life, individual life, personal life, as well as your health. So that means you are having a great problem now. You will have to understand this, and you will have to follow the treatment. Treatment in the sense both medical and psychological. Here the psychological treatment means counseling. Medical treatment means there is a medicine, there is a various medical interventions. So what are the factors where we can say that this person X, person Y is addicted or having this problem? So the mainly tolerance. So I am going to explain one by one. This is a tolerance. This is pictorial presentation I would like to say to my viewers. So tolerance, that means their quantity will rise. In the beginning you may take 30 ml, then keep on rising. So their tolerance level keep on rising. That means in a simple terminology, they will not get kick very easily. That means they have to drink more and more. Then only they'll get they are satisfied, or they get the kick. So psychological kick. So that is a very important criteria where we can say that they are having a problem. Another, craving. So this is another very important factor to say that they are addicted, they are having a problem. Loss of control. So this picture tells you that how plane is missing its balance. Same thing, the human, the person, when he is taking any drug, substance, they will also lose the balance. This is another criteria say that they are having a problem. Withdrawal symptoms, the moment they stop, or the moment they miss particular dose or particular timing, they may feel uncomfortable. Some withdrawal symptoms like mild tremors, their hands will be shivering. That means they have to take next drink or next smoke. So if there is a gap in the chain, they feel tremors, they feel their hands are their hands are shaking. So this is the very common symptom. And nausea, vomiting they do face, and irritability, sleeplessness and decreased appetite. So these are all the very common withdrawal symptoms to say that this person is having the real problem. So he or she required treatment or support now. So when we are providing another factor is a salience. Dear learners, so you need to understand that when you are counseling, you will have to explain them systematically. That's why I mentioned this picture. And now you can see when the person doesn't want to quit, doesn't have a motivation, So he can say that I am perfectly all right, I have no issue. So, but when you are explaining to them, when you are providing the counseling to them, very scientifically you have to counsel them with all medical records. That again, the records, it could be laboratory records, it could be any scan, any MRI, or any individual records, all of them relate to their medical records. You will have to explain them what are the ill effects of these substances or these drugs on the individual. So we should not give a general statements here. So individual, there could be a liver test, there could be cardiac test, there could be their blood test, there could be their scanning test, there could be their MRI scan. So n number of tests will be there. So many people will have hypertension, many people will have diabetes, and many people will have various other cholesterol related issues. So we will have to explain them, look, this is your test, and all the tests are done based on your samples. So that means all these drugs, whether you are taking cannabis, whether you are taking nicotine, whether you are taking alcohol, all of them have caused, the particular substance what you have taken, even the cough syrups, when sleeping pills, you have used excessively, they cause lot of side effects on your body. That's why you are having diabetes, that's why you are having hypertension, that's why you are having cancer, that's why you are having a tumor, that's why you are having diabetes. So like that you can explain them. Many alcoholic people will have a liver related issues. Liver dysfunction is very common. So you will have to explain them systematically, scientifically, very slowly with the factual information. Then only they'll understand. Otherwise they'll say, I don't care, I don't bother. And you will have to tell them that what are the other issues you are having it. So what are the other major complications they are having? Medical, finance related issues, social issues, family related issues, occupational issues, legal issues. For example, when the person with alcohol, nicotine, when they are having these issues, when the problem is very severe, they do face various issues in their life. So we need to tell them that because of your substance addiction, there are issues in the family. I'm going to show some slides so that you can understand. Because of time constraints, I'll show some slides. So this is the medical the issues. You can show this body and explain them. These are the issues may come up in your health. And these are the financial complications. If you spend too much amount of money on your substances, you will have a shortage of money, or your daily needs, family needs will not be able to meet. So you will have to explain them. And family, look at this picture. It will tell you what are the family issues will happen when the person is not able to get rid of any substance, alcohol, cannabis, all of them. So they'll have a lot of issues among family members, children, all of them. So we have to tell them that these are the main issues. Social, you will not get a respect in your community, you will not get a respect in your family, you will not get a respect in your society, even your friends will not respect you. So occupational issues, you will not be able to function properly wherever you are there. That particular addiction will take away all your energy, all your probably whatever you wanted to do it. It will also cause a lot of issues for your higher cognitive functions, memory, intelligence, all of them. So please do understand, learners. You will have to explain them systematically. Of course, there are legal complications. Drink and drive is very common. Under the influence of alcohol, substances, they do create a lot of issues, and it will ultimately they will end up in jail or various legal issues. So we will have to systematically explain them. We'll have to tell the families as well as the individual who is suffering from any substance, saying that these are all the various effects are there. So kindly follow our treatment. So again, there are different psychiatric complications. Mood symptoms are very common. They will rise. They will create major issues. So panic attack is also very common. So dear viewers, I am going to wind up this session in 2-3 minutes, so that you can that we will maintain the proper timing. So what are the counseling methods? Individual counseling is there. Predominantly we are going to provide them relapse prevention strategies, coping mechanisms, anger management, stress management, and family counseling, family therapy, and interpersonal counseling therapy is also there with family members, and group therapy. So very community interventions. So all of them are part of this counseling. Thank you.